Hello, and welcome back to Authentically Shawna. I'm your host, Dr. Shawna Burke. Today, I am joined by a colleague, which is fun to say, and friend, Dr. AJ White-Graff. And AJ has quite the collection of letters behind DPT, which is Doctor of Physical Therapy. So I'm going to list them all out for you and tell you all of the amazing accolades that go along with that. So AJ is a DPT, so Doctor of Physical Therapy, has taken an exam to become a certified orthopedic specialist, is also a COMT, which is a certified orthopedic manual therapist, has a certificate, is it a certificate or certification in strength and conditioning?
Yep.
So CSCS, and is a 500-hour E-RYT, which has to do with yoga teacher training. Thank you for coming on and sharing your knowledge, because that is a lot of knowledge to hold under one name title.
Thank you.
So AJ and I met in graduate school. We went to Cal State Long Beach. We have our doctorates in physical therapy together. AJ has saved my academic life more times than I could count on my hand. AJ is one of the most organized and well thought out thinkers I've gotten to work with. Like, the notes and the level of note taking and your organization and your manual therapy skills really, truly saved my butt in grad school. So thank you so much for all your help. I'm so excited to have AJ on this podcast. And something that I think we're both really passionate about is injury prevention. And something our profession is really skilled at is understanding musculoskeletal injuries. And we'll say the flip side of the it's not an issue, but I think the difficulty is that we generally only get to see people once they're injured. And I think once you understand injury, you understand how to prevent it. And unfortunately, we don't get to do a lot of that in our jobs. And so that's why we're here, is to talk about injury prevention in some of the activities that AJ is really familiar with: yoga, running, and weightlifting. So AJ does all of those activities and sees patients who do those activities. So really well versed in, okay, what are the things that people are coming into the clinic injured? What injuries has AJ personally had? And how do we kind of bridge that line between movement wellness and injury? And how do we help people move well without injury? So
Awesome.
yeah, I'm excited to have you on this episode. So my first question for you is, what do you think is injury prevention?
That is a great question. I think in order to actually answer that question, we have to talk about how we get injured in the first place. So I personally kind of think about injury happening because of one of two reasons. Number one, and the most obvious kind of reason we're getting injured, is because of traumatic events, like a fall, a car accident, a skiing accident. Something traumatic happens, right?
That isn't generally preventable.
That isn't really preventable, right? Of course, there's little things we can do sometimes to make sure terrible things don't happen, but for the most part, it is out of our control. The actual preventable injury oftentimes is what we think of as a more cumulative or repetitive stress kind of injury. So those are the things that we're looking to prevent. Ultimately, for me, this comes down to balance and moderation. We were just talking earlier how extreme we are as humans. It is so hard for us to find balance and moderation in virtually everything that we do. From an exercise standpoint, I think the first thing you can do is look at yourself and ask yourself, am I an overdoer? Somebody who is sometimes doing more than one workout a day, working out 6 to 7 days a week, almost has no rest days in their exercise routine. So maybe you're on the overdoer side, or maybe you're on the underdoer side. You work a sedentary job, so you're sitting for 8 to 10 hours a day already, and then find it very difficult to stay consistent with an exercise routine. Maybe you're working out 1 to 2 days a week. So for the most part, I would say all of us fall into one of those categories. It's really hard. It's just, I guess, in our nature to kind of be at one of those extremes. So first asking yourself, which one of those am I? And then we kind of have to tune it down or tune it up so that we're somewhere kind of in the middle and we're finding a little bit of balance in what we're doing. The other part of it is that every exercise routine should actually also have some balance within that routine itself. So this includes a wide variety of movements at varying speeds and under varying loads of resistance. And I think, unfortunately, this comes down to doing more of the workouts that we actually hate doing, right?
Yeah, absolutely.
Yeah.
I couldn't agree more. And we'll get into more specifics of each different type of exercise that we are chosen to talk about. But I think that's really good groundwork to say it's not just one thing. And I think that goes back to what you were saying is the balance is like when we find this one thing that we really enjoy, we do it. Ugh.
Yeah,
But then we kind of ignore the other person that we don't want to do.
exactly.
So guilty myself.
Exactly.
So, it's like, oh, I really like doing this one thing. I'm just going to do it again and again and again because I know it works.
Absolutely. Absolutely. Yeah. I guess, for example, myself in my early 20s is when I found yoga, and I fell in love with yoga. As a former dancer, gymnast, yoga just made sense for my body, and I was quote unquote good at it. And I found myself going to yoga 2-3 times a day. And then I became a yoga teacher. And not only was I taking classes 2 to 3 times a day, I was also teaching classes 3, 4, 5 times a day. And I wasn't doing anything else. I didn't do any strength training, cardiovascular activity. I did nothing but yoga. And I suffered significant injuries because of it. So it really, just because you're good at something and you love doing one thing, it's really important to find that balance in many different activities.
I love that. That's like the perfect setup for the next part of this, which is what are some signs and symptoms that you have that you know you're overdoing? Because I think, and I find myself included in this, is am I being quote unquote wimpy? Is this hard? And I'm, oh my gosh, this was really hard. And I don't know if I can do this because, and I could list out a litany of reasons why. Is this difficult because I'm doing too much too soon? What are some good hallmark signs that you're on the right path, but not over or underdoing it?
Sure. So I would look at a well-balanced exercise routine as including 3 main components. We want to make sure we're addressing strength, so our ability to lift relatively heavy, move heavy objects, as well as cardiovascularly, are we having good heart condition and health? And then third, our flexibility. Do we have the mobility and flexibility that we need to do everyday functional activities? So if you look at your exercise routine and say you love going to yoga and you do yoga every single day and it's your passion and it's great. When you look at the sport, if you will, of yoga, it is a very flexibility-centered activity. For the most part, there's not a high level of cardiovascular strength that is required for that activity, I guess, unless you're going to maybe a hot vinyasa class on a regular basis. Even then, it's not really a very intense cardiovascular activity. And then there's definitely not much strength that it takes to do yoga. Obviously, yogis tend to be very strong, and there is a level of strength that is required to participate in a yoga class. But when we're talking about, and we'll get into this, I'm sure, in a little bit, but when we're talking about the needs of our strength as we age, right, we think we want to be able to get up off the floor, or we want to be able to go upstairs or carry a case of waters or groceries as we get older. Something like yoga doesn't address those strength needs. So we always want to be looking, does my workout incorporate strength, flexibility, and cardiovascular activities?
Amazing. That's so simple, right? If you can keep those 3 things in balance,
Exactly.
I think that cuts out a lot of other middle ground or things that we kind of hear on social media or just kind of in the zeitgeist. Let's talk about common injuries that you see in a clinic setting that are from overuse.
Sure. I would say the number one injury that we see from overuse is going to be something that we call a tendinopathy, more commonly known as a tendinitis or tendinosis. Overarching word that we now use is a tendinopathy, meaning that there's some sort of pathology or injury to the tendon.
Let's talk about what a tendon is.
Yeah, exactly. I was thinking that myself. We're on the same page.
You're so good.
So a tendon is the end of a muscle. So we think about a muscle is kind of the red meaty part in a body. And that muscle then turns into the tendon, which then connects onto the bone. The tendon is actually from a physiology standpoint, very similar to the muscle, in that it has some contractile tissue and has the ability to contract and get stronger, and then also can relax and stretch a little bit. The only main difference between a tendon and a muscle is that the tendon is not quite as vascularized, or it doesn't have quite as much blood flow as the muscle does. The muscle is red because it has blood going to it. The tendon has slightly less blood going to it. So therefore, when a tendon is injured, it sometimes can take much longer for it to heal because there's just not quite as much blood flow to that tendon. However, it doesn't mean that it doesn't heal. It just takes longer.
And then let's talk about what a ligament is, because I think so many people, at least
Totally confused.
it's really confused. Yeah. And I can understand that.
Absolutely. Yeah. So like I said, a tendon connects a muscle to a bone. A ligament is a more and let me backtrack for a second. A muscle or a tendon connects a muscle to a bone, and its responsibility is to provide movement to the joints. A ligament is going to connect bone to bone, and ligament's job is actually to provide stability to the joints. So kind of very different in their nature, even though they kind of sound similar.
And when you look at an anatomy book, they look exactly the same. They're both white. So if you're trying to like Google search things and you're seeing a bunch of white on a picture and not knowing what is what, I could understand that it just looks like white.
Right.
It doesn't really tell you much about those structures.
Exactly.
So let's go back to tendinopathies. How do people get them? What are some common ways to get a tendinopathy?
Yeah. So I would say the most common way that we're getting tendinopathy is from overuse. This can either look like doing one thing repetitively too much for a very, very long time. So at my job, I see a lot of workman's comp cases, and I'll get a lot of construction workers with tennis elbow. And it's like, they're a construction worker. How did they get tennis elbow? Tennis elbow is a tendinopathy of the muscles on the outside of the elbow. And people who do construction are oftentimes doing a lot of hammering or screwdrivering, or they're holding a drill for a really long time, or they're driving heavy machinery. And so they're using all day long, every day, those muscles in their forearm, and eventually they develop a tendinopathy of sorts. So that is super common. The other way that I see kind of this same tennis elbow show up in a non-tennis athlete is someone who had to move one weekend. So they are someone who never uses their hands really ever. They work a desk job. Sure, they do a little typing and mousing, but they're not really using their hands on a regular basis. And then they spend a weekend lifting and carrying boxes all weekend long. And then they develop a tendinopathy in their elbow. So not only is it sometimes when you're working and doing a repetitive job for a long period of time, but it also can be one heavy repetitive weekend of one activity that you've never done before, and now it has sparked this sort of tendon injury of sorts.
Okay, so let's talk about what happens when this occurs. What are the things to do and what are the things not to do? How do you know what it feels like versus, oh, I'm a little sore, or is it more?
Yes. So, number one, I would say when in doubt, go see a physical therapist. Most states have what's called direct access. So you do not actually need a referral from a physician to see a physical therapist. You can call up your local physical therapy clinic and say, hey, I have hurt my XYZ and was wondering if I can see a physical therapist. Most likely, they will check your insurance and get you right in. Occasionally, if you have an HMO health insurance plan, you might need a referral from your doctor, but best to always just call the physical therapy clinic first, and they will let you know what the next steps are. So that'd be my first piece of advice. Second, I would say take like 3 to 7 days of rest. See what happens. If everything resolves in 3 to 7 days, perfect. Take it easy and ease your way back into your normal activity, no problem. even after 3 to 7 days, if things are still a little bit irritable, I would gently begin normal movements again. When we rest tendon injuries, they actually get worse.
Which is the irony.
Yes.
Because I think so much of our knowledge that gets passed down is rest, rest, rest.
Right.
And it's not, we're finding research wise now, that's not really
Exactly the opposite. Exactly the opposite. What I often tell my patients is muscles and tendons, like I said, their job is to move. When we move them, they get stronger, they get healthier, and they feel good. When we do not move them, they get weaker and unhealthy and become very painful. So it's super important for us to be moving our muscles and tendons in order for them to be healthy. Especially an injured tendon needs to be moved. It needs to be loaded in order for those fibers to repair and remodel and get healthier.
And I think one of the words that really stuck out to me in grad school is we talk about doing something isometrically. So I think that's still the best way to help tendon repair is to do isometrics, which is you're not lifting a weight through a range of motion. You're simply using a weight to help that tendon to engage and remind it that, hey, it's your job to be active.
Right. Yeah. Isometric contraction can be very helpful, as well as when it's in an acute phase. Isometric contraction tends to be less painful than, say, going to the gym and just lifting weights really heavy. To kind of just hold a weight and isometrically contract your muscles tends to be a little bit less painful than if you're concentrically or eccentrically moving the joint through space with a weight.
Yeah. Yeah. And I think that's such an important difference to note is we're not saying you should return to activity. We're not saying you have some sort of tendon issue. We're not saying, well, you should just return to whatever activities you're doing. Okay, what are the building blocks to get that tendon healthy? And that like requires the tendon to be loaded. And yeah, it's such a small thing, but so huge because I'm sure you see this the same that I do is someone has an acute injury. They overly rest it. It takes them a really long time to then seek care. And by that time, they're in a really strong, I'll say, cycle of pain because now they haven't been moving. So now their tendon hurts worse than if they would have kept moving. I see this over and over and over again. And if someone would have said, hey, why don't you do some isometrics? Hey, why don't you move through the range of motion that you can tolerate? They wouldn't have gotten into this cycle of
Absolutely. Pain. Absolutely. And that's why I can't reiterate enough at the first signs of an injury or any type of musculoskeletal, anything that is going on with you, contact your local physical therapist immediately. Maybe it gets better in the 2 weeks that you wait to go see them. Fine, then cancel your appointment and you never need to worry about it again. But at the first sign, contact your physical therapist and get in to see them because they can oftentimes prevent this from becoming a chronic issue that will change your life.
And we see that all the time. So we're saying this, please.
Yeah.
And I think maybe we also want to talk about sprains.
Sure. Yeah. So sprains more so tend to be a traumatic event of sorts. Like I'd say most common, obviously, you sprain your ankle, you roll your ankle and it causes an ankle sprain. This is similar to a tendon injury. I would say rest 3 to 7 days and then slowly, progressively return to normal movement. Same thing in clinic happens all the time. I have a patient who sprains their ankle and doesn't seek physical therapy for 3, 4, 5 months. And suddenly 5 months later, they're still having ankle pain, stiffness. They're wearing a brace still for just normal activity. And there really is no reason for that. It could have been addressed months ago.
And this is why we're saying this, like, please, if something happens, what you probably the conventional advice that you have heard is old.
Yeah.
Like I would say our profession does a lot of research, especially on these things. And research has changed so much in the past decade as to what to do and not to do. Mm-hmm. And likelihood that this information has disseminated, very small. So when you're going to see, and this is not a criticism of any like general practitioner that you're going to see, but they don't keep up on musculoskeletal because that's not their purview. So we unfortunately see a lot of people who've heard really old, outdated advice.
Right.
And then they waited because that was the advice that they got given. And now they're having a lot more issue than needed to happen.
Exactly. So see your physical therapist immediately.
That's our TED Talk for the day. Okay, let's talk about some common injuries that you see or have experienced with practicing yoga.
Sure. So I would say predominantly yoga-related injuries are happening to people who experience a form of hypermobility spectrum disorder to begin with. So hypermobility is in general a genetic predisposition. We all are somewhere on the spectrum of not flexible to the most extreme contortionist level flexible. People who are on that higher end of super flexible to contortionist level, those are going to be your dancers, gymnasts. They are going to be drawn to a sport like yoga because they are, again, quote unquote, good at yoga. These are the most likely people to get injured in a yoga class. Yoga is oftentimes asking us to work up to an edge and stay at that edge and tolerate that edge as long as you possibly can and just breathe and find your whatever in that. For people who are hypermobile, they're living on the edge already. And now yoga is asking them to move even further past that, which 100% predisposes them to injuries. I would say the most common injuries you'll see are shoulder or knee injuries, possibly hip or back as well. But these are going to be people who are hyper flexible to begin with. And then yoga is asking them to stretch even further than that. So I would often say that actually the people who should be doing yoga are the people who often think, I'm not flexible, I'm not good at yoga. Those are the people who actually need to go to yoga and should be going to yoga because yoga will help them fulfill that component of flexibility that they need in their exercise routine. The hypermobile people who are often more predisposed to injury in a yoga class should be actually going to the gym and doing some weightlifting and strength training and maybe get a little bit of cardiovascular activity.
And I want to go back to what you just said about people who are inflexible doing yoga, because I think that's so important. I often hear this too when I'm with people like, oh, I want to be able to do yoga, but I don't feel like I can do all the poses. I'm always like, yes, you can. And there are so many tools, and hopefully you can find a teacher who can help you accommodate.
Right.
So there's like blocks, straps, bolsters. There's so many tools that you can use.
Absolutely.
I think that make it doable for anyone of any ability to do this sport without injury.
Absolutely. Yeah. I believe that Western yoga has changed dramatically over the last 20 years. Even from when I started practicing 15 to 20 years ago, I feel like the mentality has shifted. You used to be kind of living on this edge of if I go one more inch, I'm going to break kind of thing. I think more and more studios and more teachers, I think many of us have actually gotten hurt and dealt with a lot of injuries. And now we have known after the last 15, 20 years of practicing, we have to back off, not only for our own bodies, but also for our students' bodies. And so finding a teacher that can provide you with modifications if you feel like you're not capable of doing XYZ pose would be really helpful. I mean, it feels cliche to say, but I truly, truly believe yoga is for everybody. And there is a version of yoga that everyone can do. So finding the right teacher and the right studio that allows you that accessibility is so deeply important.
And I want to ask you, what is your criterion and what do you feel in your body when you know that you're giving your body enough stimulus, but you're not pushing it over the edge?
That is a great question. As a hypermobile person myself, I work within 50 to 75% of my possibility, basically. I will often have to back off virtually everything I do in a yoga class. I think that's the best way to put it is I function within 50 to 75% of my capability. If I'm doing 100%, I'm doing too much. And that is from my hypermobility experience.
Yeah, no, that totally answered it. I think it goes, I'm going to tie that into it because I did my yoga teacher training, and something that one of our master teachers had said to us was, can you do this pose, but with 30% less effort?
Yeah.
And I think somehow we've in our brains attached that if I'm not like about to pass out,
Right.
that I'm not doing something appropriately. If like you're saying, if I'm not pushing myself to the very edge, then I'm not doing fill in the blank activity. And I think for me, it's how do I do these activities with as much ease as I can? Can I do this pose? Can I lift this weight? How can I make it the most easeful version versus the most like, I'm bearing everything possible to achieve this?
Absolutely. I couldn't agree more. And at a very early age in my yoga practice, some teacher down the line said to me, just because you can does not mean that you have to or that you should. And that is, to this day, 15, 20 years later, still something I have to remind myself of all the time.
I'm getting loved on by a cat. Like, pay attention to me. Go to sleep.
Go lay down.
Let's talk about for your body, because you're a body who does yoga.
Yes.
Well, let's talk about what the counterbalance is and how you do yoga and weightlifting and like kind of what that looks like in a pattern or routine for you.
Perfect. So again, I'm always thinking of a balanced exercise routine as containing flexibility, cardiovascular strength, and weightlifting or physical muscular strength. So for myself, when I look at the practice of yoga, from a strength standpoint, yoga does quite reasonably meet the requirements for pushing strength. So it does involve a lot of chest and shoulders and core, kind of front body strength and stability. What yoga lacks, however, is there's no pulling in yoga. There's not much. There is a little bit of spinal extension in yoga, but as far as the back body strength, there's not a lot of that going on. So when I'm doing my weightlifting program to help kind of balance out my yoga practice, I'm doing a lot of pulling exercises. So rowing, lat pull downs, reverse flies. I do a lot of deadlifts and squatting to work on more back body strength and support. And then as far as a cardiovascular balance, I will often turn my weightlifting program days into a circuit training or superset kind of situation. So I'll pick 3 exercises that I'm going to do in a row. So I'll do, for example, I'll do rows, overhead press, and deadlifts. So maybe a single leg deadlift because I like to work on a little bit of balance too. So rows, single leg deadlift, and an overhead press. And I'll do all of those back to back to back. So I'm getting this element of cardiovascular strength as well without much a rest break, so that provides me a little bit of cardio while I'm doing my weight training.
Which is great because then you can double dip.
Yeah, exactly.
It's not one more thing that you need to add.
Totally.
It's a way to work on muscle strength and endurance and cardiovascular strength all at the same time.
Exactly.
I love that. So if you have someone who is a yoga practitioner, that's their favorite thing to do, what's kind of the conversation of getting them to adopt some strength training practices?
That's a great question. I would absolutely have a conversation with them about how it is so important to find this balance in our exercise routine, and that yoga is not a well-rounded form of physical activity that meets all of the needs that our body needs, and that starting to do some weight training that involves pulling kind of activities is actually super, super important. Yoga is very much a pushing activity, and to find that balance is extremely necessary for your function throughout your lifetime.
Amazing. Now we're going to flip it and we're going to say, let's say someone is, I only strength train. I only like going to the gym. The gym is my favorite thing ever. I don't want to do anything else. What are the sort of injuries that you see with people who are solely strength training?
Absolutely. I would say these injuries do tend to be more similar to what we were talking about earlier in tendinopathies, right? They're doing these repetitive strength activities that could lead to an overuse injury, such as a tendinopathy. These tendinopathies are oftentimes related to posture and alignment most times. So performing repetitive shoulder activities such as an overhead press, bench press, and chest flies, these can all lead to an umbrella term that we would call maybe shoulder impingement, which shoulder impingement kind of encompasses a rotator cuff tendinopathy or a biceps tendinopathy type of experience.
Which would be like something's going on the front of your shoulder, something's going on in the back of your shoulder.
Yeah, absolutely. And this often is actually addressed by giving people postural cues to help open up and reduce the kind of pinching that is occurring in the shoulder.
Let's talk about ways that people can look in a mirror and kind of see, is that me?
Absolutely. Easiest way is just sit up tall. Your chest should be lifted, or the fronts of your shoulders should be kind of broad and open. And there should almost be a little bit of your shoulder blades behind you kind of coming slightly together, not pinched necessarily together completely like you're doing a row, but they should be slightly more together than apart.
I know that we see this commonly is we talk about like the humerus, which is your shoulder, is a lot of times rotated for people. I think because, again, most people have desk jobs or jobs where we're doing a lot of sitting. So your body's going to adopt a posture where everything is more closed in the front of your chest.
Absolutely.
Which is why I think you're also saying strengthening your back is so important.
Totally.
With that balance. But I think the caveat to that is if you're trying to strengthen your back in a position where your shoulders are forward, yeah. Now you're creating more of a strength pattern in the position that we don't want you to live in because it's creating compression in your shoulder joint.
Exactly.
In that case, I would say I do find it really helpful to work with someone who knows structure really well. So maybe that is seeing a physical therapist or a personal trainer who you know is really skilled at cueing.
Absolutely. Posture. And that is 100% something I would recommend if you're new to strength training, even if you're maybe not so new to strength training, having a couple sessions with a highly skilled individual, either a personal trainer or a physical therapist who understands alignment and posture is extremely helpful to help you prevent those injuries while you're doing strength training. Absolutely.
Yeah. And so then the same question is, what are the counterbalances or what's a good balance if you love going to the gym and the gym is your thing? What are some other activities that you can do to help to offset the pure, like, I'm building all the muscle?
Yeah, I would absolutely, if yoga is not your thing, and I mean, most yoga classes nowadays are extraordinarily expensive, as well as you're committing an hour and a half to driving to a studio. Maybe you have to pay for parking. So I'm not saying you have to go to a yoga class by any means, but finding a well-balanced flexibility workout of sorts. I don't know if you can call a flexibility thing a workout. Why not?
We will.
Right?
Yeah, we will.
That stretches all our main muscle groups. So I would say this includes starting from the bottom up, calves, hamstrings, quadriceps, going to hip flexors, our lower back, and then through to our chest, our upper back, our shoulders, our neck. A well-balanced flexibility routine that you can perform in maybe 15 minutes every day would be absolutely appropriate. Sometimes it is recommended to perform more static stretching, so prolonged stretching where you're holding a stretch for 30 to 90 seconds at a time. That is recommended to do after you do your kind of power activities, so your weightlifting, doing stretching after. Prior to your weightlifting activities, doing more dynamic stretching, holding a stretch for 2 to 5 seconds, and then coming out and doing, say, 10 repetitions of that stretch is a little bit more appropriate for a pre-workout type of flexibility routine. And on that note, I think warming up prior to a weightlifting session is actually one of the most easy ways to prevent injury as well. So that's where I would say start off with a little bit of your cardio. If you're going to the gym, and I know a lot of people struggle to just go sit on a bike or treadmill for 30, 40 minutes. What I'll often tell people is go do 5 minutes on the bike, go do 5 minutes on the treadmill, go do 5 minutes on the stair stepper, go do 5 minutes on the elliptical, and then now you've done 20 minutes of cardio. Easy. And you're not bored. It was just 5, 5, 5, 5 of a bunch of different things. Then do a little dynamic stretching and get into your weightlifting, and then close it off, cool down with some static stretching. And you have a wonderful, easy peasy routine.
And I will say the other thing that I tell people is if you're going to warm up, do similar movements to the ones that you're trying to ideally lift to.
Sure.
So there's, I think, another way to also get that in is to use that as your time to work on your mobility, because you're working maybe in a slightly different range because it's less heavy, but you're trying to engage those same muscle groups.
Yeah.
That way your body is primed to do said movement.
Absolutely. Yeah. So if you're doing a pull day at the gym, you're going to do some rows, lat pull downs. Maybe you start on the rowing machine to warm up. So you're getting your cardio, but you're also starting to perform some of those pulling kind of motions already.
So yeah, I think it's great if you can. I know a lot of people just go to the gym and are like, I don't know what to do. It's like stack things similar.
Mm-hmm.
Like if you have a plan, if you want to have a pull day, okay, great. What are the similar things that I can do? Okay, great. I'm having a push day. Great. I'm doing a glute day, whatever it is. Find things that are similar and then start to stack them with each other.
Absolutely.
That helps. That way you're not like, okay, now I'm going to do a squat and then a bicep curl. And then maybe I should do a Bulgarian split squat. It becomes this kind of
totally
random hodgepodge. If you can kind of understand this is my focus, then I think it makes it easier to build in the cardio and the mobility portion of it as well.
Absolutely.
Let's now talk about something that you are also very familiar with, which is running. So what are the common injuries that you see with your people who are diehard runners? Because runners are diehard.
They are. So I think anyone would understand this, even a non-runner. But most people with injuries related to running are going to have knee pain of some sort. This is, in general, again, comes back to a tendinopathy of sorts. A patellar tendinopathy is probably the most common situation that we're going to see with our runners. It is a repetitive stress injury of sorts that irritates the patellar tendon, which is kind of right below the kneecap.
Let's talk about that because I think most people don't know this. So let's talk about your quadriceps, where they start and where they
totally. Oh, this is like, I don't know, I geek out on this all the time with all of my patients, and I can't wait to show every single patient that I have my knee model in the clinic. So your quadriceps are the muscle on the front of your thigh. They're a very big, powerful muscle. They go all the way down your thigh, and your patella or your kneecap actually lives inside the tendon of your quadriceps muscle. It is a floating bone that is encapsulated in the tendon of this muscle. And then that tendon continues on and it attaches onto the little bump down on the front of your lower leg bone. So our quadriceps is massive and it has many different components and parts, and it is just absolutely fascinating, incredible muscle. Go look it up.
We dare you. You'll see all the white past a certain point.
Yeah.
You'll know that that's a tendon.
Yeah, it's incredible.
So I think something that people don't realize with knees especially is that because, and with running, that patella is sliding and doing a lot of gliding. And if you're not doing something to kind of help that, that's when people tend to get themselves into injury.
Yes, absolutely. So running is obviously a very repetitive activity, right? You go out for a 5K, that's about 10,000 steps of the same thing. And running is actually a very limited range of motion. You don't actually have to move your knees and your hips through a great degree of angulation in order to perform the act of running. So you're not getting a lot of flexibility. And so those quadriceps muscles get very, very tight while your kneecap, like Shawna said, is kind of just sliding back and forth. And that is pulling on the tendon of the quadriceps and can cause some injury there. So with running, Having a balanced flexibility routine is super important, as well as making sure you're doing enough strength training for your glutes and your hamstrings to help offset the load that the quadriceps have to bear can be really helpful in preventing knee injuries while running.
Something that I don't think a lot of people have access to or talk about is how to test the strength between your quadriceps and your hamstrings. And I would say there's some technology is changing, right? So there's some pretty simple, easy tools where you can tell how many pounds of pressure that your quadriceps can move through and how many that your hamstrings can lift through. And ideally, we're looking for a balance.
Absolutely.
And I think what you're saying is so important is if you're doing running, your quadriceps are going to be doing the majority of the work. So how are you offsetting that when you're not running so that your body can tolerate this really large force that running creates?
Absolutely.
And you probably remember this better than I do, but I think they say that when you land on a single leg, how many times your body weight is that on joints?
I don't.
It's maybe like 3 times.
Yeah, something.
It's a lot higher than you would think of if you're jumping and landing on one leg, which is running. That the forces that go through your joints is like, I'm going to make up the number, but I think it's 3. It's like 3 times the amount of just walking. And so if you're doing that repetitively, you're going to want to make sure that the other muscle groups around it can also help support you.
Yeah, absolutely. I would say also, this is just my own PSA about running in general on that same note. That's not to scare anyone away from running. I think it's a enormous myth that running is bad for you. We often think, oh, running is bad for your knees, so don't run kind of thing. Or I can't even tell you how many patients I've had who went to their doctor who told them they should never run again because it's hurting their knees. There was a study in the JOSPT, or Journal of Orthopedic Sports Physical Therapy, in 2017. It was a systematic review and meta-analysis that found the incidence of hip and knee OA in recreational runners to only be 3.5%, which was actually lower than the 10% of hip and knee OA in control groups of people who do not run at all. So in fact, according to this systematic review and meta-analysis, recreational runners actually have lower incidences of hip and knee osteoarthritis than non-runners do. So let's totally debunk that myth. You can run. It's in fact good for your knees to do some recreational running. I guess on the flip side of that, that same study found that there's a slightly higher incidence of hip and knee osteoarthritis in competitive runners. So at a certain point, right, if you are a competitive athlete, there is a higher incidence of osteoarthritis. But if you're just a recreational runner, it actually decreases the odds of you acquiring hip and knee arthritis.
Which is so funny, right? Because again, I think we've spent a lot of time talking about what are the things that are no longer true that we've heard so often. And I think that's what's interesting kind of about the time that we're living is there's so much research now. And unfortunately, it takes 10 years for it to become general knowledge.
Right.
And so we're kind of in this huge lag phase of, especially in musculoskeletal conditions, we're in this huge lag of what prescribers, whatever their medical degree is, what they learned in school, and what's true now. So they're telling you information that they learned in school, which was valid at that point, but we know so much differently. And so, I think that's one of the really difficult parts is people are using old information and relying on old information to be what we now know, especially in terms of arthritis.
Absolutely. Absolutely. I might also add, as far as running goes, I think many runners are also on the end of the spectrum that we talked about earlier that like to work out every single day and do a little bit too much, too far, and too fast. One of my favorite books on running is called 80-20. It's by Matt Fitzgerald. And it's the idea that 80% of your runs should actually be run at a moderate heart rate zone level. So it's kind of trendy nowadays, but zone 2 running, which is 60 to 70% of your heart rate max, which is actually considerably slow for most recreational runners. So I as a recreational runner myself, when I'm running a zone 2 run, I'm running close to a 13 or 14-minute mile. It is,
Which I'm sure feels
so slow. I feel like I could almost walk faster. But performing 80% of your runs at this slower pace prevents you from overdoing it and potentially getting injured. And then you're only spending in your week 20% of your runs on speed work, which allows you to go out and, once every 6 to 8 weeks, go run your 5K and get your personal best time. But you don't need to be doing speed work 100% of the time in order to hit your personal best every time. Doing your zone 2 kind of training will actually help build your cardiovascular base so that you are actually more capable when it comes to those end moments in the race where you need to dig deep and you have your speed work that you've been working on, but you have this base that you're relying on throughout the majority of the race.
And how are you measuring this? Are you looking at your watch?
Yeah. So I use an Apple Watch. This is not a plug for Apple by any means. I'm sure almost every smartwatch device out there has some version of this. Apple Watch in particular, if you log a run, if you scan through the different screens while you're running, there is a screen that actually shows you what zone you're in, which is kind of nice. So you can, if you say, I'm going to go out and do my zone 2 run, you can flip to that screen and make sure your heart rate stays within that zone 2 the entire time you're on your run.
Amazing.
And again, if you are new to running or on the slower side of a recreational runner, zone 2 might be a run walk for you, or it might even be just a fast walk for you. And that's okay. I think is a very humbling experience to go through this kind of zone 2 training, but it definitely is one of the best ways to prevent yourself from getting injured and having those overuse injuries in running.
Because then you're not going to be running.
Right, exactly.
Because then
then you cannot run because you're injured.
Yeah. Let's talk about like a week in the life. So if you're trying to combine all of these things in a week, what does that look like?
Sure. Well, I guess I'll maybe share my own routine. So first thing in the morning, I wake up and every day I do a tiny little yoga routine. Again, as a hypermobile person, I have learned my limit and I know that I don't need to do this grand yoga routine. So I've sort of developed my own little yoga stretch routine that kind of, again, covers all the major muscle groups. And it really only takes me maybe 10, 15 minutes to do this, but it always feels like a nice way to start the day.
And I'm going to say this probably because you have already considered this, but you're not stretching things that are already really flexible.
Exactly.
You're stretching things that are a little bit more challenging for you. You're not repeating you're not moving into your flexibility even more.
Exactly. Yes. I am focused on the things that often still feel tight and I do not stretch them throughout my day. 3 days a week, I do a running program. 2 of those runs are easy or what I would consider to be in zone 2. I do a kind of middle distance zone 2 run one day. And then I do a long distance, usually on the weekends, I'll do a long distance zone 2 run. And then my third running day, usually in the middle of the week, I do some intervals. So it is a kind of faster run with some speed work followed by a walking period for a number of miles like that. And then 2 to 3 days a week, I enjoy rock climbing too. So 2 to 3 days a week, I go to the rock climbing gym and I'll do a little bit of rock climbing. And then I will also follow that up with some weight training. My weight training program includes squats, deadlifts, overhead press, bench press, bicep curls, pull-ups, and maybe some shoulders, whatever I feel like doing that day. But I try to keep it a little bit of everything. I think about I want to do some pushing and pulling, some upper body and some lower body, and I'm trying to kind of hit all my bases every time I go to the gym.
And things are going to help with rock climbing, and then things are going to do the opposite of what
Exactly.
Or whatever, you're doing a lot of different sports. What's going to help running? What's going to help? What's going to help so that I can run more? So then that's total body.
Yep.
Which is amazing. Is there anything that we haven't covered that you wanted to share?
I think that maybe covers it.
We did it.
We did it.
We talked about injury prevention. I feel like in a really tangible way. So if you feel like you don't know where to start, I think our number one recommendation will be find someone who can help you create a program and a path.
Absolutely.
We had this conversation, like the really difficult part is we know so much, but we had to get doctorates in this to understand how to create and prevent injury, because other trainings, our yoga training, strength and conditioning, it doesn't necessarily teach you how to prevent injury. It teaches you how to be good at that thing, not how to prevent injury within that. So I would highly recommend working with someone who knows how to prevent injury. That way they can create a plan for you with that in mind so that you get to do the things that you love for a really long time.
Yeah, absolutely. I think on that note, I would say, and we had talked about this earlier, but it's hard to go to a physical therapist when you're not experiencing pain. However, I think sometimes if you're concerned that you're going to feeling pain with an exercise, or if there's some sort of functional difficulty that you're having throughout your life,
like stairs, getting up and down off a toilet, getting groceries out of your car.
Yes. Any of those things, you don't have to be in pain to necessarily go see a physical therapist. So if you're having functional difficulties, that is also a perfectly valid reason to go see a physical therapist and get evaluated and have them help you develop a program, a balanced program, in order to return yourself to full function without the chance of an injury.
And I think our goal and hope as people who look at musculoskeletal systems is to help people move throughout their lifespan, right? This isn't just, oh, you played a sport in school, you danced, whatever you did in your like formidable years. Okay, how do we transfer this and make this transferable so that you're moving and that movement impacts the ability for you to live independently throughout your life?
For the rest of your life, yeah. Absolutely.
I know we're both really passionate about that, is how do we help people be independent in their own bodies, in their own space? And a lot of that comes down to creating, like you're saying, creating a balanced program, creating things that help your body to maintain that over time.
Absolutely.
Oh, well, thank you so much for joining me. I hope everyone took little nuggets away from that and figures out how to apply that in your own life.
Yeah.
You've been listening to Authentically Shawna with Dr. Shawna Burke. The information contained in this podcast is provided for information purposes only and is not intended for the purpose of diagnosing, treating, curing, or preventing any disease. Before trying any of these techniques referenced in this podcast, consult your healthcare provider. Opinions of guests are their own, and this podcast does not endorse or accept responsibility of statements made by guests. Thanks for joining, and we'll see you next week.